Hey, good afternoon, guys. This is Jared Smith, and we are going to talk about the community health issue of the opiate epidemic and the treatment modality buprenorphine, or known to more people as Suboxone, as a treatment method. Um, Up until 1956, drug addiction was not recognized as a disease. For the most part, people were just thrown in psychiatric units or jails and just kind of put there to, you know, get off the drugs, but afterwards there was no treatment to heal them. It was just, hey, you're off drugs now. Let's just, you should be fine. And then through, years of research, they have come to an understanding that, hey, this isn't just a substance use problem. There's more of an underlying issue. The first stat that I would like to let everyone know is that in 2017, 72,000 people died of an opiate-related death, and that's really what raised a lot of the red flags here in the country, and made the higher ups in the nation look around and say, "Hey, we got to do something about this problem that we're dealing with." It wasn't just a city problem anymore. It used to be just in the inner cities, but now in 2017, it really came to a head that it's in the suburbs just as much as it is in the cities. The community we're going to talk about, as I kind of referenced to here a little bit, is everyone. It's not just, in one certain location. It's not just, where I live here in Lancaster County. It's not just down in Chester County and Westchester. It's not just in Pennsylvania. It's all over the nation. Everybody's dealing with it, whether it be directly or, indirectly through a loved one, an aunt, an uncle, a grandparent, mom, dad, brother, sister, anything like that, or even friends you went to high school with. I would bet a lot of money that, excuse me, that some of those people that I just mentioned have or are continuing to have problems with substance abuse. Um, and really, it's a better time in our country right now with all the resources available to be able to get help than it was, say, even 10 years ago. There weren't as many resources as there are now, and that's truly a blessing for not just people like myself, but anybody that is suffering with substance abuse. The number, according to the National Survey of Drug Use and Health, is 1.7 million Americans in 2017 were abusing prescription drugs, and 567,000 others were using heroin. That might not seem like a huge number, but that number has only skyrocketed in the last, probably 3 years, um, since the whole, pill shopping epidemic happened. So I apologize for the repositioning of my face and the pause. My three children are home from school with the COVID going on, so I had to handle the situation with them. But as I was saying, the pill epidemic that was going on in America in like the early 2010s, all the way up until about 2015, 2016, until the government um, finally cracked down on the dirty doctors who were selling all the pills to people. I mean, I'm sure many of you have seen the documentaries or the 2020 shows, or or even from reading in this class or another health class about the doctors down in Florida who were prescribing people opiates, massive amounts of pills with no prescription. Uh, they were just giving them prescriptions, and no symptoms of any kind of pain. They had billboards up all along, the highway up going up and down 95, and they would just say, hey, pain, cash only, and that's what they were doing. So what happened was the government came in and they cracked down on this, and they really got all the dirty doctors out, and what they ended up doing was creating a vacuum for all these people who had this opiate problem, and now had no means to get their opiates. So what they ended up doing is majority of them turned to heroin, which is drastically cheaper, but it's also way more fatal. And people who primarily might orally or nasally take opiates with the pills, the oxycontin, the oxycodone, ended up turning to heroin and intravenously using heroin, which just skyrocketed the overdose deaths, in the nation. So buprenorphine is a great tool in that sense that when people get treatment, they go to a medical detox or a hospital of some sort, and they get put on the Suboxone. They will not only like not have the cravings, because buprenorphine blocks cravings from opiates, and it also doesn't allow them to be able to get high off of the opiates that they would like to use. So if somebody was taking buprenorphine, and they decided to go use opiates, they wouldn't get the effect or the feeling or the high that they're looking for, that they would have gotten before they were on the buprenorphine. So some of the ways that buprenorphine really helps in early recovery is the initial relapse is usually within like the first 30 to 60 days after treatment for people coming out of drug and alcohol treatment, and buprenorphine is a great tool in that risk area, like those first 30, 60, 90 days, and people who use that in that time period have seen higher chances and success rates of getting their children, their jobs, their houses, all those things back, more rapidly and easily, because they're not relapsing right away. And there was a study of 110 patients who, after a year and a half on buprenorphine, retained all the things that we just mentioned. So 110 is a lot. I mean, one is a lot in my opinion. I mean, if there's one thing out there that can help one person, I mean, that's great. You know what I mean? But of this study, they found 110 patients out of, I believe the sample size was like 1,000 people, which, I mean, I know like 11% isn't knocking things out of the park, but that's a great tool. I mean, and that's better than a 0%, I mean, or even 10%. Another way that buprenorphine is effective is in combating, the HIV epidemic. That's not as crazy as it was in the 80s, but it's still still alive and well here, in the United States. A study included that the study included 16 HIV positive patients, and it concluded that the use of buprenorphine in a controlled setting and with nurses and doctors involved, only 4 patients reported any use of opiates within 12 weeks. And that's absolutely huge, because more commonly 60% of drug users relapse after 30 days in treatment. So, you know what I mean? That's 4 out of 16, you know what I mean? That's what is that? I don't know, 25%. So that's great, you know what I mean? Like we're doing pretty well there. So what I would like to talk about now is, some possible, solutions other than buprenorphine, because not everybody does believe in the medicated assisted treatment. But what I do have is I have a couple brochures, of some substance abuse facilities. The first one is a more local facility here in Pennsylvania and Chester County. It's a company I used to work for. It's called Retreat Behavioral Health, and this flyer is actually, talks about medicated assisted treatment here, and it just goes into describe everything, with the naltrexone, the Vivitrol, which is, it's a shot that people get. The naltrexone is a pill form, but the Vivitrol is a shot that people will receive once a month, and it does the same thing as a Suboxone. And then they go into talked about the Sublocade, and the buprenorphine. And the next pamphlet I would like to show is for the facility that I currently work for and have for the last couple of years. It's Resurgence, California. We're located in Los Angeles, and we're also located in Orange County, which is right about 45 minutes down the 405 of LA, but that's all relative because traffic's crazy. But what my point is that there's treatment out there. There's help out there for the people that are, suffering from this, the communities that are suffering from this, because anybody that, as I mentioned earlier, that knows somebody suffering from, you know, substance abuse, you know, it affects, you know, a lot more people than just the person that's actually addicted to the drugs or the alcohol. So it really, does affect a community, whether it's a big community, little community. Um, and what I my goal is to see, the stigma of addiction, broken, and we're making great strides. But in order for people to be able to be comfortable, because it's already, something that a lot of people do in the closet. Nobody wants to come out and say, hey, I've been using drugs and alcohol. Nobody grew up, when everybody, the people come around in kindergarten and say, what do you want to be when you grow up? Nobody said, I want to be a drug addict. Um, so it would be great to see more resources, more people being willing to help, and understanding of, you know, what is really going on here. For example, my grandfather, one of the best men I ever met, he's one of those people that used to, be like, well, why can't you just put it down? He couldn't ever understand why, like, he just couldn't stop. Like, hey, if I could stop, I would, like, I know this is bad for me. I know this isn't helping my life. And if we can get more people to be open and honest about what they're dealing with, and the resources out there, the medicated assisted treatments that are out there, the treatment facilities, the different forms of meetings and whatever helps people, would be huge, and it would help our communities. It would help the people suffering, and all in all, we would all be better for it. So thank you guys so much.